Okay. And let me just pin myself here. Okay. Hello and welcome to the University of Health and Spiritual Sciences with your host, Enzo Aliota. I'm having the great pleasure to sit with our founder of the university, Dr. Bill Akpana. Dr. Bill, good morning.
Good morning.
Good to see you.
Good morning, Reverend.
So we're going to get into an amazing topic. You're basically one of the pioneers of oxygen therapies, especially from what I know here in the New York area. You've been studying this for over 25 years. And so before we get in, I know you wanted to start with an intro, quick little PowerPoint, and then we can get deeper into everything. But before we do that, guys, let's just take a moment of centering and mindfulness. So if you would like to bow your head, close your eyes, we ask our source for wisdom and knowledge to strengthen our mind. We ask our source to open our heart, and we ask our source to provide the knowledge that will strengthen our body and preserve us for all time. Thank you. Okay, amen. So with that being said, Dr. Bill, can we start with a little introduction into oxygen therapies? And would you like me to share the screen for that, or would you like to?
Why, certainly. We can do it together. This is an amazing topic, and this is one of the most important topics that we're going to present. Something that if you pay attention to and you apply, you will get a tremendous benefit in your own lives. I know Tahila has gotten a lot of experience now being with me, working with me. I'm very proud of her. You know how far she's come along, and she's seeing the benefits of this in our research center. So let's get down to the core foundation of what we're talking about, oxygen. What is oxygen? It's all around us, okay? It's in the air, but air is not 100% oxygen, okay? We're talking about 16, 17, 18, depending on where you live. We're up in Vermont, where we are, it's beautiful, lots of oxygen, pine trees in Manhattan. Up there is probably 18, 19%. Manhattan, it's probably about 16, 17% on a smoggy, polluted day. And, oxygen is one of the elements of air. Now, oxygen itself is an odorless, colorless gas. It has no taste, okay? And it's soluble in liquids. It's not flammable, but it supports combustion. And it was discovered around 1772 by a chemist by the name of Priestley. It's a very important component in our lives. Now, it's got an atomic weight of 8, okay? Atomic weight of 8. It's diatomic, so you always have 2 molecules of oxygen. You have basically 3 orbits, okay? The lower orbit, the K, and then the S, and then the K. So you got 2, 2, and 4. Now, they share electrons, and this is very important for cellular metabolism, aerobic metabolism, breaking down foods, making the body, converting to ATP, oxygen transport in the body, immune system function and protection, detoxification, viruses, fungi, bacteria, things that we pick up. And it's critical for brain function, liver, kidney. The brain is a very greedy organ. It only makes up about 2% of the body weight, but it consumes 20% of the oxygen, 25% of the oxygen, sugar. So you can see how important this is. We can live 40 days or so, according to scripture, without food, 5-6 days, maybe a little more without water, without oxygen, 4 minutes, maybe 5, maybe 6, if you're really good at holding your breath. And there's a whole bunch of breath holding exercises, in fact, that can help you with this.
Awesome. So what we can do is, Dr. Bill, I'm going to share a little PowerPoint that we put together.
Yes.
So we can go a little deeper into everything that you just mentioned as an intro.
Yes.
All right.
Before we even get into the ozone and peroxide and everything else.
So quick little screen share here. Quick little PowerPoint Dr. Bill had put together for us today. And we'll go in slideshow mode. So oxygen therapies. And you mentioned the atomic number being 8. You talked about diametrically, the weight is 16, but we look at it, you break it apart into 2.
Diatomic, yeah. It's a little fuzzy there. Forgive us. I should have blown this up a little bit better, but you can see the symbol is O. The atomic number is 8. And 8 we know is also infinity in Eastern medicine, so it has a very powerful effect. Okay, and it has a configuration, as I said, 8 electrons in different orbits. Now, the interesting thing about oxygen and oxygen therapies is that it could be influenced by energy fields. Okay, energy fields, electrical fields. So when you do this is a practical tidbit there. If you're administering it and people are around, or energy fields around, it can shift the electron configuration. By the same token, subjecting it to good energy like light lifts the electrons to a higher level where they can be more effective. They say lift the light, because we are a spiritual medicine university, a research university. So a lot of things, a lot of energetic frequency components can affect the orbital configuration, making it even more effective, or conversely less effective.
Awesome. And I'm already having a bunch of questions that pop up in my mind. I'll wait to the end for that, but we'll jump ahead to the second slide here. Let's give that a moment. I believe this is the next slide, Dr. Bill.
Now, how does it get into our body? Okay, certain animals, they take it by diffusion through the gills, through the skin. Okay, so when we look at the basic fundamentals of it, before we even get into the other supercharged modalities, we take it through the nose and the mouth, and you have 3 turbinates, you have sinuses, 4 sinuses in the head that reduces the weight of the skull so you don't plop forward, and it also heats the oxygen. It goes through the larynx, okay, which is the naso, laryngo, and the oro, naso, and laryngo, pharynx, larynx. And what happens there is it goes down through the trachea. You have rings in the trachea, which are very, the cartilage, into the respiratory zone, okay, as you can see. So you've got, at the very end, you've got little alveoli there, okay? And these alveoli, they're beautiful. And when you look at these, they're surrounded by little veins and arteries, and that's where the actual gas exchange takes place. So the exchange takes place at that level, and carbon dioxide is expelled, oxygen is taken in. Now, always there's going to be a little bit of carbon dioxide in there. There's never pure oxygen in there. And this goes on 12 to 15 times a minute. You have a certain tidal volume that we breathe, and it's really interesting going back into the Chinese medicine mode. The whole breathing process takes about 4 minutes, so 4 seconds rather, 1.5 seconds to take in oxygen, and 2.5 seconds on the average to expel it, to take in air and expel it. Now, that's yang. In sleep, it becomes yin, and the total opposite. Okay, it's very interesting. So what can we take in under normal circumstances, forgetting about ozone and peroxide and all the other stuff? We take in normally, in a normal breath, about 300, 400, 500 cc's. Okay, so the inspiratory reserve, when we really take a very deep breath, this is why sometimes a lot of people are now practicing breath holding. It's an amazing method to increase the elasticity and the vital capacity and bring in oxygen. The maximum is about 1,100, and you got dead space, and the maximum expiratory reserve is about another 1,000, 2,000. So in grand total, with the normal lung volume, which if you put out the lungs, it would be like the size of a tennis court. That's how much tissue is in the lungs. You'd have 4 to 5 liters. And picture a milk bottle, liters. That's a lot. So between taking in, holding, and expelling it to the very end, nth degree, 4 to 5 liters could be taken in. So the lungs are an amazing means of bringing this in. We can go on to the next slide.
Absolutely.
Now, why am I showing this? We have the pons and the medulla. These are the 2 breathing centers. These are the areas that have the receptors that go up through the spinal cord that tell the body to breathe. There's receptors up there. And there's certain nuclei. It's around, the base brainstem, the very top of the brainstem. In martial arts, it's very important also because you could do a chop, you could paralyze a person's breathing. We both know that from martial arts. But these are the breathing centers of the brain. We have, I think.
Skip ahead now?
Yeah, you can skip ahead.
Perfect. Bear with us for 1 second. There we go.
Okay, and we just mentioned this. The maximum volume, we put in reverse air that can be forcefully expelled. Functional residual capacity, that's the capacity that's in there that remains at the end of a normal expiration. Respiratory diseases, this is very important. Respiratory diseases, we're going to cover this probably in the next lecture because ozone therapies, oxygen therapies, side, and all the other stuff are going to be very applicable to this arena. Go forward.
Absolutely. Bear with me 1 second.
Now, this is very important, acid-base balance. When we talk about ozone, we talk about any type of oxygen therapies, we have 4 situations. Sarah just came on. How are you? 4 situations.
Hi, Doctor. How are you?
Great having you on board.
So happy to be here.
She's a nurse practitioner, so she knows this is a good review. You have respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic alkalosis. So most people, I wouldn't say they're acidotic, but the pH being between 7.35 and 7.45, they're mostly on the acidic side. So the lungs are the gatekeepers. So hypoventilation makes you more acidic. Hyper makes you alkalotic. That's why you put a bag there and you try to, someone's hyperventilating. Now, the deeper level, when these fail, that's why smokers always have a tough time, with the metabolism. The kidneys take over. And that we've seen a lot in ICUs where when you have metabolic acidosis, alkalosis, it is not a good situation because the kidneys are the second gatekeeper by adjusting the bicarbonate and hydrogen ions, taking in, making the urine more acidic or more alkaline, keeping the pH at a constant, stable range. You could do that with the lungs. That's why breathing is so important, why we emphasize Qigong, yoga. Yeah. That's the first gatekeeper to health. Now we can go on.
And Dr. Bill, what's really interesting on that point, I love bringing the Chinese medicine to this because
so important.
I always think how they know this all these, thousands of years ago, but in Chinese medicine, we say the lungs, large intestine are the metal element, and we know that the kidneys and the bladder are the water element.
Correct.
And if you really think about it, the metal, when you heat and cool metal, it creates condensation, creates water, and that supports the kidneys.
Correct.
And as you're talking about
the 5 elements,
and as talking about this discussion here with the acid-base regulation, you can see how 3,000, 5,000 years ago, they understood that there was a relationship between lungs and kidneys. And now when we're even looking at it from a Western perspective or an allopathic model, it also kind of confirms that there is that relationship and how important it is.
Mind-blowing.
Yeah.
They had no microscopes. They didn't know what the alveoli was, but they represented it metaphorically in terms of elements. And those elements are still applicable today in treatment and diagnostic in the arena of both. Yeah.
So, and as our students progress from the master's program into the doctorate program, you're going to learn much more about Chinese medicine and the other forms of
integrated, progressive, integrated, holistic. So many different titles today. I lose track.
Absolutely. And
very important here. I just wanted to give you a diagram. Now, as the oxygen is taken into the lungs, the alveoli, you could see the carotids, where the oxygenated blood is carried to the brain. They have certain receptors, and it's hard to see this because it's small, but those receptors will tell you, see, the body has so many feedback mechanisms to tell you, well, you're deoxygenated. So there's a neurological mechanism, a vascular mechanism. So along those arteries, there are baroreceptors that tell you the partial pressure and let you know, wow, you need some more oxygen. Step up the breathing, okay, or slow it down, and let's get the oxygen balance, the pH balance right. So those are located right here by the carotids, another strike point in martial arts, another Tai Chi Qigong point. Yeah, we can progress.
Awesome. I think that was the last one. Let me just
Okay.
check.
Now,
Give me 1 second, Doc.
Before we really get into the meat of this, it's good to understand the dissociation and saturation of oxygen. Why are we doing oxygen therapies? Why is this so important? Because when you understand this, and if you could apply a systematic method where you can increase your oxygen in your body, because the world is deficient right now. Carbon dioxide levels are going up. If you can increase this, your health will increase because your immune system gets better. A lot of the white blood cells, the neutrophils, the phagocytes, they use peroxide to, it's like the Blob, the movie The Blob. It goes in there and starts, destroying things and eating it up. They destroy virus, bacteria, fungi. They need oxygen. They need peroxide. The immune system needs it. Your metabolism needs it to progress, like to promote ATP formation from ADP. So this is very important. And even though we teach breathing and all, we're going to get to like the grand kahunas in just a little bit.
Absolutely.
So maybe we could go over that video shortly.
Yeah, absolutely. So we're going to share our screen once again, and we're going to be looking at oxygen saturation. So bear with me for 1 moment here. Let's X out of this. Okay. So, and this video you could also find when you log into the Masters portal, into your student portal, into the Masters area. You'll see it says Introduction to Oxygen Therapies.
And we thank the person who put it up there because it's a very informative video.
Yeah, absolutely.
It's very nice. We acknowledge that. And
so we will watch about 10
praise.
minutes of this. Yeah, absolutely. So let's go into a screen share one more time. And again, you'll be able to access this inside the portal. So let's also make sure that it is working.
That exists when it comes to oxygen levels in our blood. This relationship looks at the ties.
So before we get into this, if you can hear it, give me a thumbs up. If you can't hear it, we're all good. Okay, perfect.
Can I talk while this is going on too, or no?
We can pause as you want us to
Okay.
talk. Okay. So we'll start it, and here we go.
In our bodies, there's a relationship that exists when it comes to oxygen levels in our blood. This relationship looks at the ties between how much oxygen is actually bound in our blood cells at various oxygenation levels, and it really gives us a representation of how readily oxygen is available to be used. We often express this relationship as a graph, something that we call the oxygen hemoglobin dissociation curve, which I'll discuss now. All right, you guys, welcome back to another video lesson from ICU Advantage. My name is Eddie Watson, and my goal is to give you guys the confidence to succeed in the ICU by making these complex critical care subjects easy to understand. I truly hope that I'm able to do just that, and if I am, I do invite you to subscribe to the channel down below. When you do, make sure you hit that bell icon and select all notifications so you never miss out when I release a new lesson. As always, the notes for this lesson, as well as all the previous videos, are available exclusively to the YouTube and Patreon members. You can find links to join both of those down in the lesson description below. Also, don't forget to head over to icuadvantage.com or follow that link down in the lesson description to take a quiz on this lesson, test your knowledge while also being entered into a weekly gift card. As well as don't forget that you can help support this channel through the purchase of an ICU Advantage sticker. Again, those are found at the website icuadvantage.com/support, link down in the description. Now, understanding the oxygen hemoglobin dissociation curve is important, especially in times when our patient's physiology can be altered in ways that have an impact on this dissociation curve. Given that this curve represents the availability of oxygen to be used, alterations in this availability, aka alterations in this curve, can have real effects on our patients. So before we get into talking about the curve itself, we do have to talk about a couple things first. The first thing is going to be saturation. And when we're talking about saturation, what we're really talking about is the amount of oxygen that is bound to hemoglobin in the blood. Most commonly, we use a pulse ox and get a SpO2, or we can also use the saturation from an arterial or venous blood gas. If you remember from our A&P days, we have our red blood cells. Now, this cell here is without much of the normal machinery of other cells, including its nucleus, and its main purpose is really to transport oxygen. The way that most of the oxygen is transported is through the help of the hemoglobin molecule. Now, the hemoglobin molecule here actually consists of 4 subunits. So we have 2 alpha and 2 beta, and they have iron at the core of each subunit. And iron is the binding site for an oxygen molecule. Each subunit can bind with 1 oxygen molecule, making the maximum possible of 4 oxygen molecules bound per molecule of hemoglobin. And then each one of these red blood cells contains something like 270 million hemoglobin molecules. So that's a lot of oxygen molecules. The structure of the hemoglobin molecule.
Okay, thank you, Eddie, for putting that up there. This is amazing because think of the red blood cell. It's a biconcave cell that really doesn't have any other function but to carry oxygen. Central core is iron, hemoglobin. In plant cells, you have magnesium versus iron. That's why iron is important, you know, iron deficiency, anemias, and generalized iron deficiency. You're not going to carry, the capacity to carry oxygen is diminished. Picture 1 red blood cell. You have 4 of those heme units, 270 million of those in 1 tiny microscopic red blood cell. That's a humongous number, but that is what dictates our level of health. Go on.
Amazing.
Molecule isn't constant though. Its initial stage where it has no oxygen is something that we refer to as tense. Once we have oxygen that binds to the first subunit, it causes a conformational change in the next subunit, something that we call relaxed. This change actually increases the affinity or the attractiveness of oxygen to bind. When oxygen then binds to that next subunit, it again changes the next one, making it even more relaxed, which further increases the affinity for oxygen until we eventually have the last subunit bound, which also has the greatest affinity. And this changing affinity is something that is referred to as cooperativity. So as more oxygen is bound, there's a greater affinity to bind with more oxygen. Once we have all 4 subunits that have an oxygen molecule bound, this is something that we refer to as saturated. And when we look at the blood as a whole, we can evaluate what percentage of hemoglobin molecules are saturated with oxygen. And this is our SpO2 reading that we get. And this can range anywhere from 0 to 100%. So for an example, if we have every hemoglobin molecule that has 3 of the 4 subunits bound, the saturation of our patient would be 75%. All right, so the next thing we need to talk about is partial pressure. At its most basic level, this is the pressure of a gas. In our example here, the gas that we're looking at is oxygen. The partial pressure tells us essentially how much oxygen is available. The more oxygen that's available to the blood, the higher the partial pressure. This amount or partial pressure here that is available is going to be roughly equal to the amount of oxygen that's dissolved in the blood, but not bound to hemoglobin. And this is what's reflected as our PaO2 on our ABG. Now, important to know that while dissolved oxygen in the blood does contribute to overall oxygen availability, it actually contributes just a fraction of the oxygen when compared to hemoglobin. To understand this more, I'm going to link to a lesson above where I do talk about oxygen delivery. All right, so now that we got those 2 concepts out of the way, let's actually talk about the oxygen hemoglobin dissociation curve. So this is also something that you'll hear sometimes referred to as the oxyhemoglobin dissociation curve or the oxygen dissociation curve. If we look at the name, dissociation means to separate or disconnect. So just by looking at the name of this, we can infer that this is about disconnecting or separating oxygen from hemoglobin. All right, so here is the curve here. And for reference, along the x-axis, we have the partial pressure of oxygen, and along the y-axis, we have the percent of hemoglobin saturation. Now the curve.
Now, this is very important. 2 concepts that are going to be very critical to understand when we talk about oxygen therapy: saturation and partial pressure. Now, saturation, the pressure of oxygen and saturation, you see there's a link, and at some point it stabilizes. So when you get too much oxygen in the body, you're oversaturating it. What did he say? 75%, 100%. When the heme molecules are saturated, there's what we call a shift to the right. Okay, it starts shift to the right and shift to the left. Okay, this where it stabilizes is saturation. Where it isn't, it's not totally saturated, and the body needs this to be released. Ironically, about 2% of the oxygen is carried in plasma. Most of it is carried in red blood cells. Okay, so the actual carrying, let's just review, is due to the pigment hemoglobin and the iron in hemoglobin. The partial pressure is the pressure exerted, a total pressure. There's a partial pressure of oxygen as a sum, as a component of the total pressures, and they have a relationship. This is very important in concept and understanding oxygen therapies, especially hyperbaric oxygen. So now we can go on.
Itself has an S-shaped or a sigmoid appearance, and this is something that I'll explain more in just a minute. What this curve represents is that for any given availability of oxygen, aka our partial pressure at the bottom, how much hemoglobin is going to be saturated with oxygen. So for example, if we look at a partial pressure of 50 millimeters of mercury, we would expect, if we go up here, a saturation of 85%. Now, towards the right of the curve here, you can see that we have this plateau as we really approach 100% saturation. And what this means is that at this point, as we increase the partial pressure more and more, we really don't see much of an increase in the saturation. And obviously, once fully saturated at 100%, it's impossible to go any further than that. So our max limit would be at 100%.
So where do you want to be living? You want to be living towards the right, okay? Where you're so saturated that your body is soaked with oxygen. When you go to the left shift, oxygenation, partial pressure is low. So now that brings us to the topic that we're going to discuss today. All right, oxygen therapies. So let's proceed with that.
Couple more minutes on this stuff.
No, I think we're good with this.
Okay,
I just
okay.
wanted to give our people a little overview of how this works.
Okay, great. So again, that video can be accessed when you log into the master's course. Just go under the title Oxygen Therapies.
We acknowledge and thank the people who put it up there for us, for
Absolutely. And
everybody.
you'll see that on Introduction into Oxygen Therapies. That's one of the first videos you should be watching. So, Dr. Bill, let's get down and dirty here. Let's get into oxygen therapies, and then we'll open up some Q&A to our students.
How does this relate? How do the therapies relate to the intake of oxygen? Well, we know that hyperoxygenation is a good thing, getting a maximum degree of oxygenation. How do we do this? Okay, there are techniques. Number one of the methods, and it's been used for over 100 years in Germany, it's used in Cuba, it's used in Russia, it's called ozone therapy, okay? Ozone therapy is a very powerful, effective therapy. Unfortunately, because of the inability here in Western countries to patent trademark this, it's never gained any kind of significant foothold, but it's getting it. All the Johnny-come-latelys are coming on board right now. I've been doing this for over 25 years, and as a part of our research protocol, we've seen some amazing results. The next one is hydrogen peroxide. Ozone is a gas, okay? It's a triatomic molecule. It's produced by taking oxygen, putting it through a generator, and creating the gas. Now, it can be given in different ways, and we're going to discuss this in the next lecture, intra-articularly, into the vaginally, intravaginally, rectally, through the skin, through the ears, into the muscles. We've been using ozone acupoints to do this AcuOzone, which is amazing. Intravenously, of course, you can use an ozone solution to drink. There's so many ways. Now, peroxide is a liquid. You can give this intravenously, and both of them are very similar. There's a similarity. Some people prefer peroxide, some people prefer ozone. Ozone gets broken down into oxygen indirectly. Peroxide produces oxygen. So both of these oxygenate the body. Now, why is this significant? It's significant because, especially in the case of ozone, microbes, including virus, bacteria, fungus, cannot live in such environments. Otto Warburg, 100 years ago, won the Nobel Prize twice. I knew Nobel very well, Alfred Nobel. He was a great guy. I used to talk to him, give him advice. I kind of asked him, I said, can I have one of those little thingies that you have? He goes, what are you talking about? I said, the thing that you gave Obama and Clinton and all. He goes, what, a little prize. I like to put it in my wall, somewhere in the back. He laughed. He said, one day. So he gave, I said, I just want one. Otto Warburg got two. And his work was on oxygen, deficiency of oxygen, and the formation of disease. He actually demonstrated that when oxygen levels were low, deadly killer metabolic disease would form. And still today, despite all the evidence, it hasn't become mainstream. So it really is sad because, these things have such a potential. But like I said, a lot of the Johnny-come-latelys are jumping on board. Some of us had to take the hit for, when you're a pioneer, you're a trailblazer, you're going to take the hit. But I'm glad to see that a lot of this is being used.
Hey, Doctor, can I just ask you a question? So guys, what Dr. Bill touched base on chapter 2 of this book and also chapter 3 quickly. But there may be this kind of question that pops up when we look at ozone therapies. I know we talked quickly about some benefits, but just staying on ozone for a moment, benefits and risk. Can we just touch that really quickly? the risk documented in the last 50 years of research, I think the adverse reactions are 0.0007, which is insanely low. Okay, when you look at the risks of some of the adverse reactions that are encountered with pharmaceutical agents, especially those that are used to poison the body, you can't even compare. Okay, now that being said, if you were to do a tremendous amount, and this really comes down to the training, that's why we train people. If you were to do a tremendous amount in a very short period of time, and not know what you're doing, you can get a massive die-off. Okay, they talk about embolism. Thank God that, I mean, the incidence of that is so minute. I don't even know any recorded cases. Thank God, but there's something called endotoxin shock. It kills off a lot of microorganisms, and they release their poisons into the body. So you get arrhythmias, you can get hypotension, hypovolemia, all sorts of issues, fainting, especially if people are taking drugs and they don't tell you, breaks apart the drug, or if they're very toxic, breaks apart, separates the organic from the non-organic. So people go through reactions. So the benefits far outweigh the risk, far. And then we talk about just some simple stuff for people to understand, like something is, again, mentioned in chapter 2, but like inhaling ozone, good or bad? Yeah,
it's toxic. Like, when you talk about ozone, when I used to talk about this 20 years ago, they go, oh yeah, the ozone layer up there. No, it's not the ozone. We're talking medical grade ozone that comes from a mixture of, you take the green tank, you put it through a generator, and you're going to be using it to apply in different ways, as I said, like intramuscular, intravenous, whatnot. If you're breathing it, it's highly irritating and it can damage the lungs over time.
So not recommended.
No, unless you put it through olive oil, and there's ways of doing it, separating, but generally that's not a way to do it.
Yeah, because here in chapter 2 it says ozonated oil, which is the point you brought up, has been found to be useful in treating a wide variety of skin problems, including dermatitis, bacterial infections on the skin, staph, cellulitis, impetigo, fungal infections. And I know you have access to this. So can we just talk a little bit about even that as well? Like, is something to keep refrigerated, I believe.
Yeah.
Right.
Yeah.
Is it easy? Is it accessible? Easy to get? Can we make it? What would
that's in our second lecture, we're going to discuss some of the practical aspects, how you can use this in your own lives without getting into like fancy schmancy high technology implements and stuff like that. So ozone oil is one of these methods. You can ozonate water, which is great because it goes through the gastric mucosa into the body, and you're going to get the effect of ozone. You could ozonate olive oil. The only problem with ozonating olive oil is you have to bubble it in a certain way. It doesn't really retain the ozone.
Yeah.
So there are people who do it on an industrial level. They make it cold. You get it cold, you keep it in a refrigerator, and it's said to be good for like 3, 4, 5, 10 years. Actually, when you smell it, you could actually smell the ozone in the oil. And like you said, it kills a lot of staph, fungal, viral infections. It should be something that you have at home.
That's awesome. And then just before we go ahead, you mentioned hydrogen peroxide. This is what we call H2O2. Correct?
Yes.
Okay.
Yes.
And that's 2 atoms of hydrogen, 2 atoms of
Correct.
oxygen. Okay. And in chapter 3, it talks about 3% oxygen, hydrogen peroxide, and then 35%.
Yes.
And just for our students to understand the difference between the 3 and 35%, can we touch on that real quick?
Yeah. Food grade now. Food grade peroxide is different from the stuff you get in pharmacy and you put in your skin. They put some toxic components in there, so you don't want to drink that under any circumstances. People have been poisoned. When you're talking food grade hydrogen peroxide, you're talking 35%, or sometimes you can find it in 12%. And the 35% is usually the more commonly available one. What you do is you put a drop of that in a glass of water the first day, 2 drops the second day, go all the way up to 10, 15 drops. It's really not irritating. You'll start tasting the peroxide after a while. And you do this on an empty stomach, and you could do it once or twice a day, 3 times a day. People who are sick, who had life-threatening illnesses, there's documented cases where they've been doing this and the disease has been put into check because you got so much oxygen being liberated as an direct and indirect byproduct of the ozone getting into the body, and it definitely diffuses through the gastric mucosa into the system. So you're talking about a form of hyperoxygenation that you could do at home.
So which would also create what we call saturation, right? That would help.
Yeah,
saturation.
that's exactly why we showed you that. The oxygen saturation and the partial pressure curve, it shifts it to the right. So what happens before it plateaus, the red blood cells, those 4 receptors, those receptors on the red blood cells become saturated. So the oxygen saturation level goes from 90, 95, 100. 95 is like normal, considered normal, 96, 97. In areas where people live, there's full of, we have smog and pollution. It's less in clean, pristine areas like the mountains, like Vermont, you have a lot more oxygen. So that shifts the curve to a hyperoxygen level.
Right, awesome. And so you're saying titrating it, I know we had mentioned years ago, up to 14 days, so 1 drop day 1, 2
Exactly.
and by the 14th day you start working backwards, 14, 13,
Right, and you
12.
drop it,
So,
and like anything else, like anything herbal, you give it a pause, then you start it all over again. Okay.
yeah, and that's a great point, because I think that as people are learning oxygen therapies, well, and I know you're going to get more into this, the applications in lecture 2, but don't run out there right away and start thinking, I got to go buy oxygen machine, I'm going to go out there and buy an ozone machine, I'm going to start doing this intravenously. You really have to know all the mechanisms, which is what we're discussing behind it.
Yeah.
But something like food grade 35% hydrogen peroxide, you can find this online, right?
Yeah,
Just
yeah.
I know that answers Zuma's question where we
Yeah.
find it, and then titrate it, like you said, up to 14 days, and then work your way back, and that's basically the course of a month.
Yeah.
So if we were to look at just for health maintenance, because we're at naturopathic medicine is maintenance medicine, right? This could be something you do like every quarter, right? January, do it for the month of that. Do it in April. Do it every quarter of the year, just as a maintenance protocol, or would you stay with it every month?
You could stay with it for the rest of your life.
Perfect.
I mean, I've given you some ICU stuff, because my background is anesthesia and I did a lot of critical medicine and I ran 2 programs. We're talking the oxygen chips, blood gases. I mean, you go into the femoral artery, you draw the gases, you do ABGs. I mean, that's high end, but it's good to understand that because those concepts apply to ozone, the saturation apply to ozone, to peroxide and to hyperbaric oxygen. The same principles that are used and applicable in the ICU and the operating room apply to what we do on a very similar level.
That's awesome. Yeah, so we touched base on ozone. That's chapter 2. We touched base on hydrogen peroxide, chapter 3. Here I made a note about hyperbaric oxygen therapy.
Yeah.
Can you touch base on that?
Now, hyperbaric oxygen therapy, that's there are a lot of chambers that people are buying these home chambers, which are okay. There's nothing wrong with them, because they go up to about 1.2, 1.3 atmospheres. When you have hyperbaric, that's the third major modality: ozone, peroxide, and hyperbaric, HBOT. Hyperbaric therapy done in a medical setting usually will employ pressures of 1.5, 2, 2.5, even up to 3. Now, the problem is you got to be very careful. You can't have sparks. It's highly flammable. There was one case where a little child was in there. They didn't see it. He had one of those little trucks, and the friction thing. And the doctors and nurses going, "Oh my God," So the kid was going, vroom, vroom. It blew out the chamber, blew out the side of the building, and killed everyone. So oxygen, while not flammable, will support combustion. And at that level of high concentration and pressure, it could do some weird things. But it has some amazing benefits to the body. Now, the thing about hyperbaric is it's basically oxygen delivered to the body under pressure. Okay, so we can get these chambers, and it's a good idea if you're a naturopathic practitioner. You can get a chamber that has 1.2, 1.3. I have one at home, and it works pretty well. It's actually, you feel pretty good. You're laying in there, and you can take, there's so many home do-it-yourself forms of oxygenation. Like you said, you can use it on the skin, you can use it peroxide, and take it internally, and you're in a chamber, so you're oxygenating in every way without getting really fancy schmancy and using high technology and without training. But the hyperbaric, the thing about that is the difference is it is very useful in wound healing. Okay, ozone will help with wound healing. Peroxide will help with wound healing, and we've seen it all. I've been using this in our research for over 25 years. But hyperbaric is specifically designed for wound healing. So the main categories are, gas gangrene, wound healing, carbon monoxide poisoning, and osteoradionecrosis. So when people get radiation therapy for tumors and whatnot, a lot of times that tissue is dead, it's necrotic. When hyperbaric oxygen therapy is used, that tissue will regenerate. Peripherally, you start getting blood vessels that are built up. Now, ozone has a special quality because it probably kills microbes better than any other form of oxygen therapy. But the hyperbaric produces new blood vessels. Okay, so new blood vessels are produced, new capillaries that, because of the pressure, especially in the brain, you're putting so much pressure in there that it's like a highway that's saturated. Now the highway's building little side roads. So it's forcing the metabolism to go into a hyper mode, producing more little tributaries, capillaries. And the other thing about it is that even though the ozone and the peroxide will help cellular regeneration, hyperbaric oxygen will help produce stem cells probably better than the other two. So you got wound healing, you have development of blood vessels, and you have stem cell formation. So each one of these, although all of them are great and you can use all of them interchangeably, hyperbaric has a special function. And you need to be very specialized. There are MDs who operate this. They have I've taken a course, I got certified in hyperbaric, and it's fascinating. But you really have to, when you do this, you have to have someone there. A good history has to be taken, pulmonary history. You got to make sure that the ears are okay. You don't have any tympanic membrane issues. So these are very useful in disease prevention and health maintenance.
Awesome. And I know this isn't necessarily a topic that we studied just today, but it is, I think, on point. And just a good old-fashioned Qigong, Dr. Bill, good old-fashioned breathing. If you don't have access to food-grade hydrogen peroxide, and you don't have access to the ozone machine, or you're not trained, and you don't have access to hyperbaric oxygen chambers, good old-fashioned Shaolin yoga Qigong, the book you wrote. And so, I believe there's something to be said in towards the back of this book. They talk about the sages, the wise men. They knew about the power of prayer. They knew about the power of meditation and focusing on breath. I don't know if it was necessarily called Qigong or what they call it.
whatever they called it.
But
at the
they
time, yeah.
knew that if you just kind of quieted your mind, you closed your eyes, and you focus just on your breathing, that there was an element of health to that. And I know you touched on it before as far as tidal volume and inspiration and exhalation. But is this something we can go a little deeper into just for a moment? You know, we talk about is it belly breathing? Is it intercostal breathing? What do our students need to know when they're teaching someone this?
Good point. Very good point, Reggie. Now, like when you look at a baby breathe, the best way to do Qigong is watch a baby breathe. All right. They breathe naturally. So it's always abdominal breathing, and that is diaphragmatic. Okay. That's a sheet of tissue below the base of the lungs. And there's two mechanisms or two vehicles that help you breathe. One is the intercostal muscles, of course, and the other one is the diaphragm. So if you practice diaphragmatic breathing, you are really utilizing more of the vital capacity, more of the lung function than just breathing intercostally. And if you look at a person that's stressed, you know, they compressed what we call the metal element, the lung, large intestine are related. So a lot of times when this is compressed, you're not having that heaving motion massaging the large intestine, and you get this a lot with laughter, Qigong laughter movement. So there's a lot of constipation, and you know, a movement of waste products don't go out. So Qigong and Tai Chi, yoga, these are all incredible mechanisms to optimize breath work. Now, we just said before, like you're taking in 300, maybe 400, maybe 500, depending on your size and lung volume of air. When you do Qigong, you are massively expanding the intake of oxygen, and you're moving it in a rhythmic fashion that is more useful to the body. If you look at it, it's all about breath, movement, and Qi. One of the other things right now is like that's getting popular with the Wim Hof is holding the breath.
I was going to mention that.
So you're breathing, you're taking in as much as you can, and then you're exhaling. Okay, so you're really increasing the inspiratory and the expiratory reserve of the lungs. And what are you doing? As we get older, the elasticity will diminish. So you're maintaining the elasticity and the surfactant in there. The surfactant is that like the sticky gooey stuff that made there's a lot of phosphatidylcholine in the surfactant, and that's from eggs, meat. That's why nutrition and lung function are so related. That stuff helps you breathe, and the more you expand, the more you utilize, open up those little alveoli, the healthier and the more elastic the lungs can remain. That's why, I mean, these are not the only methods, the intravenous, whatnot. There's a lot of do-it-yourself at home methodologies, and we're going to get more into these as we go along.
Yeah, and I know as we get more into the Shaolin Yoga, we'll teach you guys more about the breathing, but even as you said, the holding the breath, very simple box breathing. Inhale, hold for 4 seconds, exhale for 4. So you inhale for 4, you hold for 4, you exhale for 4, and you hold for 4. If you just added that, and as a naturopathic university, what we're at a spiritual university as well, what we're focusing on is health maintenance, right? We're talking about not this one magic bullet. It's not like, well, I get sick tomorrow, let me do Shaolin Yoga breathing today. You know, I'll get sick today, let me do this. It's about every day, you know, and I know your rituals and my own rituals personally. I'll wake up every morning, get my sauna, immediately practice my breathing and stretching, and then immediately red light therapy, and then immediately the vitamin C, the lemon peels. And so if you could begin to create a lifestyle, and this is what naturopathic medicine is a lifestyle of how to live, all these come together. And I know in lecture 2, you're going to get into foods. I know we're going to talk about the foods that promote oxygen in the body, beets and whatnot. But Dr. Bill, just real quick before we wrap up, some of the research you've done, I know we have different modalities. You have Herbazone, AcuStem. Do any of these relate to oxygen therapies?
Yeah, they do. And we can cover those more in depth next time too.
Okay.
But we will touch on them now. I remember like 25 years ago, Renshi, as we call him, high level master, used to come to my house, and we'd be practicing Kung Fu, Qigong, Tai Chi like 2-3 times a week. We would start the morning exercise, and this becomes, like you said, a part of a ritual because he's such a high level practitioner and teacher and master, that this is something like you said, you have to do it like the way you eat, the way you sleep, the way you drink water. It should become a part of your daily routine. Like you don't do it, as you said, like when you get sick. Oh, I'm sick. Let me do some Qigong. By doing this, you got some amazing preventative maintenance there. And that's do it at home. Do it yourself oxygen therapies, without having to resort. The other stuff is great. We swear by it. We live, we're just creating new methodologies, but this is a very simple way to do it. Now, we have in our research protocols, we have developed different techniques. One of them is putting the ozone through the acupuncture points. And that is an amazing method because it's been determined like in the 1950s that using radioactive dye, probably on prisoners, bad, God forgive these scientists, and they discovered that qi, or these nutrients, flow through those invisible channels and the interfacial planes called the meridians. So we started putting oxygen therapies and applying them through the meridian system to target them to go to these specific areas. And the results have been amazing. Another thing we're using is Herbazone, which is we trademark patented. Herbazone is using the aqueous salts of certain anti-inflammatories, namely serapin and other components, tramil, and using them with oxygen therapies, putting these into the acupoints again, using ozone and the herbs in combination. So we just continue doing research, but the possibilities of improvement are endless. This is a new horizon. It's still new. Like when you look at the use of ozone in the Western hemisphere, in Western medicine, really, we're talking 20, 25 years. And 25 years ago, people were actually like Atkins, Dr. Atkins, the diet doctor. They brought him up on charges for doing this. And this man was saving lives. He was a pioneer. It took a toll on him and he died. But he was a pioneer. People were being prosecuted. And that's how science works. Until it becomes mainstream, they go, oh, that's how it was all the time. Meanwhile, certain pioneers have taken a risk, put themselves out there, done research, compiled data from the research, and it's in its infancy. It's really still in its infancy.
It's amazing that you say that. But guys, page 21, Dr. Bill just mentioned Dr. Atkins. But if you really just go through the course the way you're supposed to and read about it, you're going to see, the reasons why it's not FDA approved. You're going to see all these different studies on, it's not a moneymaker. The pharmaceutical companies, unfortunately, fortunately for us, unfortunately for them,
they don't promote it.
You can't patent it because that's your oxygen and you
No.
can't do that. So today is the foundation. We touched on the first few chapters of oxygen and healing therapies. Stay tuned. Next week, Dr. Bill, you're going to get deeper into techniques
and methodology. And it's interesting that you would, before we sign off, on why it's not useful. It's very cheap. It's not patentable. On one of my trips to Russia, I met a lot of the Russian scientists. This was about 20 years ago. And I couldn't figure out for the life of me why, this is before I got into medicine, why people were going to Cuba. 50 years ago, I'd hear these stories, Cuba is dirt poor. You don't have medications on the shelves. There's no techniques. People would be going and coming back, quote unquote, cured of cancer. The cancers would be put into check. And I just couldn't figure out for the life of me. And then I went to Russia on one of my trips. One of the doctors said, oh yeah, we put this into Cuba. We have clinics. I said, darn, wait a minute. Cuba is a satellite of Russia. It's one of the communist countries. And Russia put all its technology. All you need is oxygen, an ozone generator, and some skill to use it. So people would be going there, getting better and coming back. Now it's being implemented. I understand why it was a Russian satellite and cheap. You can have it in a third world country. People can have infections, tropical infections, protozoal infections, virus, bacteria. Take the ozone, take the generator, take the tank, and all of a sudden people are getting better.
So amazing. So awesome. Thank you for sharing. I think we have one question here. I'll just check that real quick. Let's see. Can we get some? So Zumo, I think that was your question in reference to the hydrogen peroxide. And again, it's as simple as going online, Googling 35% food grade hydrogen peroxide. If you can't find 35%, as Dr. Bill said, 12% would work. Just do 3 drops instead of 1, just to
Right,
make it
right.
more potent.
Make it more potent.
That's just hope that answers your question. And are there any other questions in regards to the introduction into oxygen therapy? Does ozone work on eczema, Dr. Bill?
Yes, yes. There are many cases in the literature of eczema being helped with the use of ozone. And with eczema, you can use systemic application. You can bathe in it. You can have it IV drip with blood therapy, they call it. Or you could use, as the Reverend said, the cream, take ozonated cream and apply it there, and you'll get a benefit.
And I'll say I had worked with a patient on that using the cream. Again, these are things, they are readily available. So you go online, Google it, look for the purest form. If you're not sure, email us or go into our discussion boards. If you're not using the discussion boards, these are new to the university. They'll be coming out as of January, but you can access it now. Get into the discussion boards and share any questions that you have. Share it in the master's discussion board. But also, if you come across the hydrogen peroxide, post it in there, and we will do our best to let you know if it's the proper one to have. All right. So, Dr. Bill, until next week, we're going to sign off. Are there any other questions? Great. Well, everyone, enjoy the rest of the week. We look forward to seeing you same time, same place next week. Have a great day, everyone. Bye.
Thank you.
Have a good day. Thank you.
You're welcome. Bye.